Diabetes management is an ever-changing landscape, and joining me now to discuss this further, Kos Sklavos, health strategist from Synapse. Thanks for your time. So, plenty of commercial opportunities for pharmacists then.
I guess, for example, for our pharmacists watching, using your dispense software to do an analysis on diabetes medications, and then you can benchmark against other reports, say, look, have we got our share of diabetic patients, looking at their... So when people use a lot of prescriptions for the year, they can reach what we call an entitlement level of either free medicines or highly subsidised medicines. So that's a low-hanging fruit that you can do an analysis on those patients. Are they diabetic? Are they doing testing? And so I guess the theme out of APP is when we're trying to build new markets. So, you know, my colleague who presented yesterday, Donna, gave a real practical examples. I gave a lot of the big picture and the business case.
I believe as pharmacists we play a very important role in empowering our patients with diabetes to have the skills and knowledge in order to manage it more effectively, and to be able to also be able to manage it way more effectively, and also optimise our opportunities in which we can grow our professional services and be remunerated for them. So it's all about becoming part of a healthcare team, and that's what we have tried to do in our pharmacies. Some of the professional services that we give, we do the diabetes meds checks and the meds checks. We normally start our processes in a lot of these cases with clinical interventions. So somebody comes in, we pick up an intervention, and then it gets referred on to a meds check or diabetes meds check. So we, as mentioned, we do home medicine reviews, and we do the accredited credentialed diabetes education clinics. We have a DAA program, so that's to help patients with compliance issues. We have a weight loss clinic. We have blood pressure and blood glucose monitoring programs, so people can come in with their meters and download their data onto our systems, in which we record and we help people analyse that data. And also with our blood pressure monitoring, it enables the patient to take that printout to their GP and to have something to talk to their GP about. We also have a wound care section. We have nurses in the clinic. We work closely with the nurses with wound care, so it's really quite interesting when you're working as a team, some of the treatments that you see with regards to ulcers, leg ulcers, and working together to try and get the best outcome for the patient. Okay, so pharmacist role. Well, our role in our pharmacies, we are heavily involved in identification. So we do a lot of screening for those at risk of developing type 2 diabetes. So pretty much when someone brings in a script for a blood pressure medication or cholesterol, cardiovascular, we will ask them, you know, do you have anyone in your family with diabetes? While you're waiting, would you like to do an Oz risk tool or assessment? When they're getting their blood pressure monitored, we also look at that as well. A big thing that we noticed when talking with the GPs, and something that they pointed out to me, is that they would really like for me to refer back to them with regards to the annual cycle of care. So when patients with diabetes would come in, you know, just to remind them, have you gone back and seen the doctor about your referral to the ophthalmologist, which is every 2 years? Have you gone back and seen them about your HbA1c? A lot of the feedback from the GPs that I got is they do send out recall notices to patients, but quite often those patients didn't follow through on them, and they do constantly send out recalls, but they found it really helpful if I could also reinforce that. Again, given with the new NDSS changes, a lot of the questions that we will ask people when they present a metformin script is, do you need strips with that? And it is quite alarming when you actually get down there and start talking to the patients and realise that there are a lot of them that just simply aren't monitoring. It's not something that they believe or think they need to do. And we do run meter clean and check days too. That's also a way of just generating some interest in bringing up topics concerning diabetes. It's just about generating that interest. Okay, so some tips and advice. What we did was we did our research. The closest diabetes centre from our pharmacies was a half an hour away. We did have a part-time diabetes educator that worked, but I think it was only one morning a week within 5 minutes. But most of the ones, the big centre that was half an hour away, they predominantly dealt with just insulin initiation. So all the people that are just on metformin really don't get that opportunity. And again, mentioned before, have a look at how many people are actually monitoring, and also what other services are available in the area. Where is your podiatrist? As Cos mentioned before, it's really important to find out who is in your area that can also support you, and that they're fully aware of what services you have to offer. So becoming a part of a healthcare team is crucial. You get the input from your GPs, ask them what they would like to see in your clinics, and let them know what you do and what you're able to give. And I think that's really important. If they don't know what service you give, most patients will take that leaflet that you've put on the counter or put in the bag, and they'll take it to your GP. The GP knows nothing about it. Again, having adequate tools and resources. National and state, there are abundance of national and state-based resources. You've got Diabetes Australia, you've got NDSS, you've got MPS. There is a lot of resources. There's food diaries. A lot of the companies also provide the resources. And also making sure your staff have the skills and the knowledge as well. There are a lot of diabetes courses that are available as well that you can do. Advertising, you really need to advertise your service. We found that what we did a lot of flyers, we did brochures, we had posters up. We would document when we'd spoken to someone about possibly enrolling in the diabetes meds check program, that if they qualified for it. And yeah, we put a lot of this stuff near the dispensary. Our pharmacists predominantly are out the front, so quite often we are the initial sort of conversation point there, so we can also speak to them about the programs we have to offer.